If you have a tight fascia or a restricted fascia, then you're going to always kind of be at this more sensitized level of fight or flight for no reason.
Welcome to the Movement Driven Podcast with Dr. Greg Goldberger, where we help you bridge the gap between pain and performance. Each week, we'll share strategies, insights, and real-life applications to help you keep moving and stay driven. Now, let's get into this week's episode of the Movement Driven Podcast. Hello, everyone, and welcome back to the Movement Driven Podcast. I'm Dara Sweat here with Dr. Greg Goldberger. Greg, how are you doing today?
I'm doing well. How are you, Dara?
Doing good. It is the most wonderful time of the year, and so I'm very excited. Kind of can't believe how it's already like the second week of December,
It's
and
crazy.
and it's like almost the end of the year, and it's just so crazy.
Well, you're
So
looking festive in your candy cane sweater there.
none of our listeners are gonna be able to see it, but
Oh,
just
no.
yeah, just know it's great. It's a number. I'll tell you what. Um, but so I think the focus of the next couple of weeks to end out 2025, we really wanted to kind of focus more on some educational points. I think everything that we've done in the podcast so far has been, obviously, our heart behind it has been to educate and inform. But these topics I feel that we've kind of come up with are definitely going to dive into a little bit more, not complicated. That's not really the word I would say, but just some trigger words that I think are thrown around that influencers and other people are using to try to not scare you, but use tactics to get you to think that they know what they're doing and this, that, and the third. But this can really help kind of understand that a little bit better. What would you say about that?
Yeah, I would say like today's topic specifically, I think there's a lot of myths behind it because it is like this popular like word that you hear in this industry, the fitness industry and the rehab industry, the term fascia, which you'll introduce in a second. But there's a lot of myths that I think we can break down and, in future episodes, I know we're going to talk a little bit about the kinetic chain, which the fascia plays a big role in. So we'll talk a little bit about that. But all of these like buzzword terms, like you're saying, that people don't really have a true understanding. And I think the people saying them on social media don't have a true understanding, and I could have a better understanding, to be frank. But let's kind of dive into it and see what we can learn today.
Yeah, awesome. So I think first and foremost, for those audience that maybe they've heard the word but they have no idea what it is, or they think that they know what it is, can we just define and break down what fascia actually is?
Yeah, and like fascia, right? Like myofascial release, foam rolling release, like all these things that we've tried to do, and like plantar fasciitis, and we hear this term fascia, and I say it all the time, like, you've heard term fascia, right? And patients nod their head yes, and I'm like, okay, they've heard it, but doesn't mean they have any idea what it is. So yeah, let's get right into that. Fascia is like this connective tissue, and we largely thought of fascia as being only a connective tissue. And if I had to describe it, if you imagine like a very well made spider web that was layered on top of each other, spider web after spider web, multiple layers, all different angles and different directions, and it got thicker and thicker, but it's very, very malleable but strong. That's the best way I can describe it. And when we are doing cadaver lab in PT school, so the first semester in PT school, we have to learn the anatomy, and we have people that have donated their body to science for us to continue to learn so that we continue to help people. And we have cadaver lab. And what we have to do every day is kind of cut through fascia to get to bone and to get to muscle and to get to this layer and to get to that layer and learn all of these different structures. And while we're doing that, it just feels like we're just pulling away at this connective tissue, but it's intertwined within everything. And we'll get into that more. But we, like, historically and in the medical community, largely thought of it as this connective tissue that we're literally just have to tear away at during cadaver lab when we're learning, or during an autopsy. And we didn't really pay attention to it. And it never really got like classified or put into a group, right? Like we largely look at medicine as a group of the body systems, right? We have your neurologist to treat your neurology problems, your nervous system, and then you have your skin, your dermatology. You have, if we go by organ, your heart. You have your musculoskeletal system, and each system has their specialty or their doctor or their profession that takes care of that system. But there's no system. We don't talk about the fascia. Nobody treats the fascia. It's not big enough, and we just discarded it. But what we've realized, and what we're continuing to realize, is how integrated fascia really is into our well-being not only on a musculoskeletal structural standpoint, but from an emotional standpoint, from a hydration standpoint, from a nervous system standpoint. And so it's this almost this really important structure. And the more that I've practiced Dara, especially the last few years, I'm really starting to believe, based on my anecdotal evidence of what I've treated and what the patients I've put my hands on, that I think fascial restrictions are the heart of a lot of the musculoskeletal and orthopedic issues that we're dealing with. Like, obviously, we have joint issues and things break down and we need surgery and other tissues break down. But a lot of the chronic pains we're dealing with, I think, are largely fascial. So I'm sure we'll
Yeah.
get into that now.
Yeah, no, I mean that's just wild to think about how, like you said, we just kind of brushed it off. Like it was just like, oh,
Literally,
this is
just
just
cut
something
through
in
it.
the way. Yeah, like this is not something that we need to like think about or
Mhm.
do anything about or anything like that. So, I know we kind of touched on it just a little bit in the intro here, but what makes it different from the muscle or the connective tissue? I know that we, talked about how it was like in the way and it's something like layered on top of it, but I mean, isn't it all just part of the muscle? I think that's a question that probably the regular person like myself would ask. Like, what makes it different?
Yeah.
You know what I mean?
I think, like, when you hear fascia, the term myofascial is also grouped together with it. And what does myofascial mean? It literally means muscle. So myo means muscle, and then fascia obviously refers to fascia. And so fascia is definitely like intertwined within our muscle. And if you can imagine our muscles, when they touch another muscle adjacent to it, then there's a layer of fascia between it. And then there's a layer of fascia between the other one, and then beneath it. And then there's a layer of fascia between your fat and skin layer and your muscle layer. But it's also intertwined around our nervous system. It's intertwined around our organs. It is literally everywhere in your body. You cannot get away from it. And so we used to like you can't see a fascial injury on an MRI. You can't diagnose it in any way. And so we, like you said, we just largely discarded it. But now what we're seeing is, like, what does it really do? We're looking at it more like this. It is a connective tissue, right? But it's wrapping everything within itself. It's conducting fluid. It's helping transmit tension from muscle to muscle or from system to system from a athletic standpoint. If we're talking to our athletes listening, it's communicating with your nervous system. It's housing, like, sensory receptors. So there's a lot of talk, like when I talk to practitioners who are referring to themselves as myofascial release practitioners, whether it be physical therapists or massage therapists, and they do very specific techniques for myofascial release. They talk about the emotional release that their patients get from these techniques, and how much pain from an emotional standpoint is stored within these physical pains. So yeah, it's so integrated with everything. It's everywhere, and we really can't get away from it.
Wow. So, what would something like fascial dysfunction show up in somebody or for like an everyday person? Like, what are some of those things that, someone can like look out
Mhm.
for to kind of see like what is maybe dysfunctional fascia in their body?
Well, I think it's almost like you can't even look out for. I would say, if we talk about chronic pain on a very elementary level, right? The people that have back pain more than 4 days a week, the people that have neck and shoulder muscle knots creep in, people that develop plantar fasciitis, people that have migraines, fibromyalgia, like, there's a spectrum of these things. And I think fascia is at fault, and maybe one of the main root causes in the pain. Like, it's not necessarily, oh, did you hurt your muscle, your tendon, your ligament, your joint surface? It's like, maybe it's just your fascia is so knotted up and wound up that it's then pulling all these other structures and creating other injuries to present themselves, and pain to alert to your nervous system. But underlying is really just a fascial disconnect from old injuries years back. So, like, when you see a frozen shoulder or something, you're talking about it like a dehydrated fascia. It's starting to adhere to the joint, and you're getting the capsule to not move well. Plantar fasciitis, we're overloading the fascia on the bottom of the foot. We're getting microscopic tears, and then we're injuring that tissue. So we need to mobilize that tissue. We need to strengthen that tissue. Chronic low back pain, like, so your thoracolumbar fascia is this big area that goes all the way from like your rib cage and your mid back all the way to your pelvis. It connects your lat It has connections to your hamstring, all throughout the back of your pelvis. Like, if you don't think that's contributed to people with low back pain, you're crazy,
Yeah.
in my opinion. So all of these, like, the things that I treat every day, I think are fascial in nature, is in terms of the cause of it. Like, I'm pretty convinced that's what it is. And then we kind of get to how do we manage these things?
Yeah. So why does this happen though? Like what are
Mhm.
kind of things that would point to making this, whether it's an old injury or just bodily function, like what is the reason why this happens?
Yeah, I think, like, first we can think of, like, people talk about, oh, I had this old injury. Do you think I have, like, scar tissue in here? And then that's also, like, this very vague thing. Like, what do you mean by scar tissue? But when I think of it, I do think of, like, a fascial restriction. That's what the scar tissue is. Like, if you had a surgery and you said, say you had your appendix taken out. Well, they have to do an incision that doesn't just go in the skin. It's not just the surface cut that you see. That incision goes all the way down to your appendix. And we talked about fascias everywhere, right? So if you don't think you have some fascial adhesions built up in that area post appendectomy, I don't. I mean, you got to, right? Unless you pay a lot of attention to it and you do very specific exercise or do very specific manual therapy during your healing process. Which, who does that after an appendectomy? Nobody. And then obviously you can take it to more, like, talk about C-section scarring, or people who have uterus taken out, or, like, imagine the emotional scarring attached to that. Like, it goes so much deeper. Like, we could probably do a year-long series on fascial topics. But so I think like injury and scar tissue and that kind of thought process, I think you think fascial restriction. But then just more the chronic, everyday, repetitive stuff. When we think repetitive strain, when we think being sedentary and being too still and not moving enough, I think that contributes. Dehydration is shown to be a huge factor. So, like, where the fascia is shown to basically transmit fluid. And so if you're not hydrating that fascia, then that fascia can't glide within itself. And then you start to break down other tissues adjacent to it, or the kinetic chain domino effect starts. And then I think too, like, stress. Everybody talks about, oh, I hold my stress in my shoulders. I'm like, oh, do you? We all do. Like, okay. Like, it's not just stress. I think there are, like, some musculoskeletal things there, but if there is stress contributing it, this is how. It's by the tissue not responding from an emotional standpoint. And I know that sounds crazy when I just say that, but your nervous system is attached to both emotion and autonomic system regulation. It's attached to how we feel pain and perceive pain, and how we move our bodies and how we fire muscles. So to say that it's not somewhat emotionally involved is probably crazier than saying it is, believe it or not. So I think all of these things have an effect, and then it goes back to what we always say is, we think movement and a good balanced diet and good hydration and good sleep patterns and stress management, like, we all know that those are the big things, right? And if you can focus on just the big macros in that sense, and you try to do good in those areas, I think everything else starts to take care of itself from a musculoskeletal pain standpoint.
Yeah, absolutely. And I think it's important to make a point here about, how pills, injections and those traditional treatments like don't really seem that they can really fix that because, it can't really change the chemical
Exactly. Well,
of your
if we're not even thinking of fascia as a system, then obviously all of these pills, injections, and other things that we've created hasn't been an attempt to regulate that system at all, because we're not even thinking about that system. None of the doctors or pharmacists or scientists creating this, they're not thinking about having an effect on the fascia itself.
Yeah.
And I think that's where physical therapists can come in, and we do kind of think about fascia all day long, if you
Yeah.
think about it.
Yeah, for sure. So as far as, like other things that we could do for it, maybe dry needling versus foam rolling, cupping, things
Mhm.
like that.
Right.
What are some of the kind of more innovative things that we could do to disrupt that dysfunctional fascia?
Well, what's interesting is I feel like cupping and certain massage techniques and the Graston tools, like scraping type techniques that I'm sure people are familiar with. I think all of those kind of their main advertisement is to like break up scar tissue and break up fascial adhesions and things like that. But what the research shows is like you need literally more than 1,000 pounds of force to deform fascial adhesions.
Wow.
More than 1,000 pounds of force. That's a lot. So no matter how heavy you are, if you're just passively laying on a foam roller, I don't think you're breaking a fascia the way you think you are. I don't, and by all means, I tell a lot of people to foam roll. I think foam roll has a really good place. I think we're doing more on a level of muscle inhibition, which is a whole nother topic, than we are on fascial adhesion breakdown.
Mm-hmm.
So foam rolling, cupping, like Graston, I think has shown like some superficial fascial adhesions can break up. So like for like superficial tendon, I think it works great. But for deep muscle fascial adhesions, or if you have scarring from old surgeries, it's not going to do much other than that superficial surface scar tissue. And so what the research shows is vibration has an effect. Now,
Oh.
I haven't seen anything on massage gun, and if that type of vibration is enough. I don't know if it needs to like be a vibration plate, or if the massage guns can do well, because I've seen some surface literature that says the massage guns don't do well enough, but more to be studied on that. But the two things that we find have the greatest effect on actually breaking down fascial restrictions are exercise and dry needling. And I would probably put acupuncture in there for attacking the right tissues, just because we're putting a needle into and breaking up tissue. So exercise, and that's kind of what we promote the most. We do a lot of manual therapy, a lot of dry needling, and movement driven is literally the name of our business. And so if you don't think we're driven by movement, again, I'm calling our people crazy today, but you're crazy. So so now people say, oh, well, you said 1,000 pounds of force. I can't move 1,000 pounds of force. Well, when we're loading system with speed and with weight and with certain directions and certain lengths of time under tension, then you are getting the point where you can actually have an impact. And you're putting more than 1,000 pounds of force through your body with some of those movements that you're doing at a very average workout. So that's what you need to break up the fascia. Now, do these exercises need to be specific and targeted and oriented in a very directed position and posture for you and your fascial breakdown? For sure. But that's where somebody like me or Elsa comes in, where we can identify those and identify and construct the right program for you. But if you're not doing some sort of dry needling and or exercise, I don't know if you're really doing much to change the fascia. Now, I say all that, there are some very famous myofascial techniques that are very gentle in nature, and there's practitioners that I've been taught by at the University of Miami that have a cash pay practice for years now that has years long waiting list, and she barely puts her hands on you.
Wow.
So who am I to say she's not doing something? Because a lot of this research at the end of the day it's not the greatest research in PT, because you can't do double blinded research. So if you find a practitioner that makes you feel better, stick with that person for sure.
Yeah. Yeah. All right. So we got a lot of background information, got a lot of just like details, kind of breaking it down and like what helps and, what it loves and what it hates. So why does chronic tension often signal a communication issue and not weakness? Like just kind of this notion that obviously fascia is emotional and is a system and it's sending out signals. So,
Mm-hmm.
so why is it that and not considered weakness?
Yeah, so I think this is like the heart of what I talk about with my patients every day. So we talk about like muscles not firing well, and you'll see people on social media say like, "Oh, don't let your PT tell you your glutes aren't firing." And it's like obviously your glutes are doing something, but are they firing efficiently? Are they firing in sync with other muscles? Are they firing in the right timing? And so that's often kind of confused as like a weakness, right?
Mhm.
But I think what the issue is, it's more of what I would refer to as a motor control issue. So when we have these fascial restrictions, our body is not giving the right information to our brain. Our brain is going to respond with some sort of output, meaning firing our muscle, based on some sort of reflex or stimulation that it receives, i.e., there are things called stretch reflexes, right? If I put a quick stretch on your muscle's reflexes to contract against it. And so when you're like, if you're balancing on a boat and you shift drastically one way because a wave hits the boat, your calf muscles stretch a certain way and react to contract to keep you balanced. So that's like how we function in society. That's just like that's an example, right?
Mm-hmm.
But if you have a fascial restriction from an old ankle fracture and you haven't had the fascia be able to communicate as well as the nervous system be able to communicate that stretch reflex to your brain, then it's not going to fire that calf muscle. And then over time, that calf muscle will get weaker, but it is from a communication issue, not from a, oh, you just need to strengthen it. You can do all the calf raises you want. If you don't fix the communication issue, there's going to be a compensation that lasts. And I think that is the heart of what I treat every single day, is finding why is there a communication issue? How do we fix the communication issue? And once we fix the communication issue, how do we build the strength and build the stamina and build the resilience of the body? But if you don't fix the communication issue, you are just beating a dead horse.
Hmm. Yeah, and earlier you mentioned you made a comment about how people always say that we hold our stress in our shoulders type of thing.
Mm-hmm.
And then saying how like it might be that, but it also could be your fascial, stiffness or anything like that. So how does fascial stiffness affect stress and emotion?
Yeah, so like what I've read about this, like I'm I was always taught that our nervous system holds memories. So when I did my residency, one of the pillars of our residency was pain science. And the way that we talked about it was our nervous system holds memories, meaning if you injured your body in this specific fashion or doing this specific movement, your subconscious could hold on to that. And I largely thought that was just your nerves and your brain and your spinal cord and all that. But I think the fascial system is largely involved because we're now seeing how many sensory receptors are housed within the fascia. So that's tied directly to that autonomic nervous system. What is the autonomic nervous system? That's your fight or flight response. Oh. So your body's determining based off of like what is pain? Pain is a protective mechanism. Your body is assessing a flight or fight response situation, and it is outputting pain to your consciousness so that you will do something about it. If you have a tight fascia or a restricted fascia, then you're going to always kind of be at this like more sensitized level of fight or flight. Like you're going to be more ready to like be reactive for no reason. Like you can be in a very parasympathetic, very relaxed state. Why are you always on edge? Well, if you
Mhm.
have this tight fascia, that specific region of your body is always on edge, i.e., stressed, i.e., tense, i.e., uncomfortable,
Hmm.
lacking blood flow, lacking hydration, lacking oxygen, creating an ischemic muscle pain that I think is largely what people feel when they're sitting at the computer at the end of the day. Now, is there posture involved? Are there weak muscles not supporting you and then putting more tension on those same muscles and they have to work harder? Yes. But for the people that are adamant about my stress is causing my pain, I believe you. I think you're right. And this is why.
Yeah. I mean, I think it's safe to say at the end of the day that hydration and movements and, are really going to be,
Uh huh.
yeah, are really going to be the key factors into decreasing the pain that the fascia is sending out.
For sure.
Is
For
that is
sure.
that safe to say?
Yeah. Yeah. I think like like it goes back to the things we've talked about before, right? Like
Mhm.
rest isn't best. You want to keep moving. You want to keep loading the system the right way. You have to fix the communication deficit. You can't not address the elephant in the room of an emotional attachment if the one is obvious during the rehab process. You have to hit that head on because there's all these factors in pain. I tell people all the time, it is not as simple as you hurt this tissue. Like, no, it's never that simple.
Mhm.
And we have to find the root cause. And I think this is part of it. And to sum it up, like you said, if you're hydrating and you're loading your system properly, and there isn't an underlying communication issue, then you should be fine in maintaining healthy fascia.
Yeah. Yeah, I think this has been super super informative. I mean, at least for me, for sure. Every time that you said posture, I was like fixing my posture, and then especially when we were talking about the pain in the shoulders, it makes me kind of wonder because I'm always working with y'all or going and get massages, and it always feels good, but then it almost is like the very next day, it's almost like that comes back. So I'm like, I know we've talked
Exactly.
about me getting on the table for some dry needling, so maybe
Well,
that's what I need to do.
there it is.
I know
Well,
I stay hydrated.
let's do that. So that point though, like hydration might be that might not be your issue, right? If you are hydrated, or maybe the hydration can't get to that specific network of fascia. Maybe the rest of your system is fine, but because you have these restrictions, the flow can't get into that area, and that area is dehydrated. So that's where you do need the dry needling or the exercise specific to break down those fascial restrictions locally.
Wow.
And then to your point about like when you get the massage or when you get the deep tissue from Elsa or me, and you get the short-term relief, there is only short-term relief at the beginning, especially if it's not accompanied by movement or true fascia release like dry needling. I think when we do deep pressure or we do kind of inhibit the muscle, you are getting blood flow and oxygen, and you're relaxing the muscle. And so you're getting a temporary flow of fluid to that fascial system, but it's not enough to overcome the years of restriction that you've already been living with. So what do we need? Movement and dry needling is, in my experience, and what the literature shows, you need kind of both of those, at least the movement part, to really kind of reset that fascial system.
Yeah, absolutely. All right, cool. Well, I think to wrap up, I have one more question, and then we can move on from there. So I think that, you know, a lot of our listeners who might be listening kind of want to know, like, okay, so like, what does this mean, right? Like, what does this mean for you know, how I approach golf, fitness, mobility, you know, whatever it is that you're doing. So how does fascia change the way we approach those activities that we love to do?
I think fascia is like, it's, you know, it's a necessary part of being able to do that. Like, it's super important is, I think, what I want to get across. Like, we talked about how it's a communicator, it's a fluid distributor, it's a glider, it does all these important things. And so we need our fascia to be healthy. So like for a golfer, for instance, like you need your fascia to be, the more that you have good fascial health, the more that you can create like elastic recoil when you go into your backswing to create power. And then the more like a CrossFitter wants to lift, you need to use the ground to do that push press overhead. That force transmission is largely a fascial property. So we all need to like be able to glide, and we need hydration, and we need like to be able to integrate this movement, you know, across multiple planes. And that's all like fascial property. So so for those of you that feel like you have an issue, you have a chronic pain, you have to find somebody that's going to fix your fascia by giving you the right movements or the right type of manual therapy technique. And then that's going to allow you to, you know, open up the posture or open up the mobility, create more elasticity, create more force transmission, and do what you want in sport or whatever your functional goal is. So like, I think it's just find somebody that can tell you where your fascial restrictions are and help you fix them.
Awesome. Well, cool. Thanks, Dr. Greg, so much. I think this was a really informative episode. I definitely want to have my little side meeting where I do my PT with you guys and kind of figure out some stuff to help my own fascia. And hopefully those who listen are also informed and want to either take some steps wherever they're listening to get this figured out for themselves, or you can always call us up at Movement Driven. Visit us online, movementdriven.com, and we'd be happy to chat with you and try to figure out how we can get that fixed for you so you can not deal with chronic pain for much longer. Thanks again, Dr. Greg. I hope you have a great day. We'll catch you on the next one.
Have a good one, guys.
Thanks for tuning in to the Movement Driven podcast with Dr. Greg Goldberger. Want to see how we're helping people in Jacksonville bridge the gap between pain and performance? Head on over to movementdriven.com. Until next time, keep moving, stay driven.